Okay, since everyone's time is valuable, let's get started. Welcome to our first installment of our mini keynotes SIBO Mini-Series event. Today's presentation is on natural treatments for SIBO, presented by Dr. Allison Siebecker. And we'll set the stage to continue the conversation on our next two installments to discuss small intestinal insights, uncovering patterns, and solutions for breath testing. And before Dr. Siebecker takes it away, I'm going to play a short video about what every SIBO patient needs to know from Dr. Siobhan Sarnar, my apologies. It's Dr. Siebecker's partner. And this is playing from the internet, so depending on your Wi-Fi, there may be some delays in the video or sound, but I will put the link in the chat if you'd like to watch it again or save it for later.
Hi, I'm Siobhan Sarna, and I'm the founder of SIBO and Chronic Condition Rescue. I wrote this book, Healing SIBO. I'm the co-creator of the SIBO Recovery Roadmap course with Dr. Allison Siebecker. We do small group coaching as well, and she also created a course for professionals called the SIBO Pro Course. You can find out all about that at SIBO-SOS. And be sure to check out our Facebook community, 30,000 almost going strong, the SIBO-SOS community. So 7 years ago, I started this project, and as a result, I have had this book. I've done 11, 12 summits, and I have had the honor and privilege of working with Dr. Allison Siebecker, along with interviewing multiple times Dr. Mark Pimentel and Dr. Ali Rezai and Dr. Stephen Sandberg-Lewis, etc., and have been just so thrilled to be able to share this information that I've learned with millions of people, literally. So what I wanted to do right now is mention a few things that I see people get confused about or get wrong. And whether you're a patient or a practitioner, first of all, I want to applaud you for taking the time to educate yourself and to continue your quest for wellness and knowledge, and to just bring up a few things that I see a lot of people stumbling over. And if you are a practitioner and you're like, I already know that, just know that your patients may need a couple of extra explanations about the following. One, stool tests do not reveal SIBO, small intestine bacterial overgrowth. That's the large intestine, small intestine, breath tests, right? The other thing is that getting 2 breath tests is a great idea. What do I mean? So what I mean is having the second breath test on hand. You take the first one, you find out what your levels of gas are, and then you do a treatment. And then within 2 weeks, it's really, really helpful to do that second breath test to see the gains that you've made. Now, not all the time do you feel like you've made any progress, but you may have, because the symptoms don't always correlate with the amount of overgrowth that you have. So having that second breath test on hand is really convenient. You've done the second treatment, or you've done the treatment, now it's time for the second breath test. So you can see if the treatment worked, if progress was made, and having it on hand is super convenient, because that way you don't have to wait for the shipment. You can make sure you have your substrate right there and it's ready to go. I see a lot of people wish that they had done this, and so many people who do know this tip and trick, so glad they had it. So if you can afford it, get that second breath test at home, ready to go, so you can really monitor your progress. It's a very, very confirming for compliance and motivational, so that you figure out if you need to do another round or if you're in great shape. I like it when you're in great shape. I know you do too. Okay, then the next thing is, here's the t-shirt Dr. Siebecker made for me, because I asked this question so often. She had me this t-shirt made. Are you on a prokinetic? In my favorite color. So what is a prokinetic? It is an agent, either an herb or a pharmaceutical, that helps with the migrating motor complex. And that is the thing that's impaired if you have overgrowth of hydrogen producers, methane producers, or hydrogen sulfide producers. So the prokinetic helps to bring into harmony and synchronize your migrating motor complex. And therefore, the sweeping motion of the small intestine is going to sweep out the overgrowth, little teeny tiny food particles. And when that's impaired, it can often lead to the overgrowth. It leads to SIBO, emo, or the overgrowth of hydrogen sulfide. So a lot of times I'll see in the Facebook group, I just did a treatment, SIBO came back. I did herbs, I did rifaximin, I did probiotics, SIBO came back. And I always ask, are you on a prokinetic? And so often they say, a proc what? So I really like to talk about it. There are, of course, herbal formulations you can do. There are pharmaceuticals that you can do, but definitely figure out a prokinetic, because that needs to happen after your treatments are done, so that you can make sure that that migrating motor complex continues to work and be maximized in order for you to hold off on relapse. The number one best prevention for relapse is a prokinetic. Now, if you're a practitioner, you may already know all of this. I hope you do. But I think some of the patients need to be reminded. And if you're a patient and you're like, I've never thought of that or heard of that before, please speak with your practitioner. You can do a lot of this DIY. Of course, I'm very pro practitioners. I talk about all the time. And the more you know as a patient, the more you can help your practitioner help you. And also you can, show up with a breath test already. You're going to be miles ahead of everybody else because you have shown up with data that practitioner can dive into very quickly and help you out with. Again, if you're looking for a course to help yourself, the SIBO Recovery Roadmap course is available at SIBO-SOS and Small Group Coaching with Dr. Allison Siebecker, world-renowned SIBO specialist, and myself. And of course, we have the SIBO Pro course for professionals that is created by Dr. Allison Siebecker. So I'm Siobhan Sarna. Thank you so much for being with me, and I wish you the best of health.
Okay, fantastic. And as Siobhan mentioned, breath test, we today launched our breath test. You may have gotten an email about it. If not, I will drop that link in the chat as well, and you can check it out. And now I'm happy to introduce our speaker today, Dr. Allison Siebecker. Dr. Siebecker has been specializing in SIBO since 2011. She's the 2021 Lifetime Achievement Award recipient from the Gastro ANP, has been teaching advanced gastrology at NUNM since 2013, and is an award-winning author. She was the co-founder and former medical director of the SIBO Center for Digestive Health at NUNM. Her integrative SIBO protocols have helped thousands worldwide. Dr. Siebecker's free educational website is siboinfo.com. And also, as a reminder today, our webinar will be recorded, and you will be sent that in a follow-up email. And if you'd like to follow along with the slides, I'm putting that link in the chat right now. And now, Dr. Siebecker, I'll pass it along to you.
Well, thank you so much, Nicole. And hi, everyone. Welcome. I'm so happy to be here. Thank you, Microbiome Labs, to invite me to speak. And thank you all for coming. So first, I'm going to share my screen and get the presentation going. Okay, is it looking good from your end, Nicole? I always like to do a technical check.
Yes, it looks good to me.
Okay, great. So thank you so much for introducing me. I'm actually going to introduce myself a little further for anyone who doesn't know me, and also because, well, I actually want to say, what is it that I'm speaking about today? Uh-oh, they're doing construction next door. I have to close my window. Hold on. Of course, right when I start speaking comes the loud. My topic today is natural treatments for SIBO. So as Nicole mentioned at the beginning, this is part one of a three-part series that Microbiome Labs is putting on in honor of their launching their new test. And we're going to talk about all different kinds of topics. And I'm taking part one here, natural treatments for SIBO. So I want to just basically introduce myself to explain my background with SIBO, to explain how it is I know about these treatments that I'm going to share, and basically what qualification I have to speak on this subject and specifically share this information. How valid is this information? So I myself have SIBO. Like so many of us, that's really what got me interested in learning about it. I've had it since I was about 5. I wasn't born with it. First, I thought it was IBS. I mean, it is IBS, and then realized it was SIBO. So I'm both a patient and a practitioner. Like so many of us, we have both those perspectives. So I started specializing in SIBO in 2011. And what I did was in 2010, I took a year off from practice actually to study SIBO for that whole year and just learn all about it because I don't know, I just really felt I must do this. So I did that. And then what I did was I joined forces with my old or former gastroenterology professor, Dr. Steven Sandberg-Lewis. Some of you may know him. He's a veteran naturopathic gastroenterologist. I'm a naturopathic physician myself, and he was my teacher. So what we did was a few things. First of all, we created a specialty clinic for SIBO at the university where we teach. As Nicole mentioned, I've been teaching advanced gastroenterology since 2013 at NUNM, and that's the medical school where we work. So we created a specialty clinic there. And, you know, with teaching gastroenterology and being here today to speak to you, I have a very strong mission to educate as many about SIBO as I can, both practitioners and patients. And I just want to mention before I move on, so I don't forget, I have online SIBO trainings for practitioners, and I have a coupon code for you for anyone who would want to join me. I would love to have you join me, and it's on the screen for you here. So just a sec, I got it. There we go. Okay, so what we did at the SIBO Center is we ran before and after SIBO breath tests pretty much on every treatment that we gave. And that meant we were able to validate the treatments that we were using with extensive testing, with proof. We were able to prove that what we were doing was working. It was extremely helpful. Of course, we tracked symptoms as well. So the whole thing lined up, you know, is the person getting better along with the test getting better? We created herbal antibiotic protocols, which I'm going to share with you today. And to do this, we consulted with many herbal specialists. We, as naturopathic physicians, were trained in herbal medicine, but we wanted to consult with people who that's like their whole life. So, for example, one of the people we consulted with was the late, great Stephen Bruner, who wrote the book Herbal Antibiotics. So I'll share those with you. We also created a SIBO symposium. It's, to my knowledge, the world's first conference just on SIBO. We started that in 2014, and we had the world's leading SIBO researcher, Dr. Mark Pimentel, who's pictured here on this screen, speak at that conference every year. So that's like just the basic background. Now let me go into some fundamentals before I get into the treatments, just some fundamentals of SIBO to make sure we're all on the same page. And for anyone who doesn't know all about SIBO, I just want to be sure everyone's included. So SIBO, just the definition is that it's a clinical syndrome of excess endogenous bacteria in the small intestine that leads to impairment of the structure and function of the small intestine and results in symptoms, GI symptoms. And that's a new definition we got in 2020. And it has really two key parts that you need to have a positive test. You need to be able to prove that there's overgrowth, and there needs to be symptoms. So the two together, clinical syndrome. What are the symptoms? They're the same key symptoms as IBS. So that is bloating, which is abdominal bloating is usually due to accumulation of gas. So when and if that gas exits, there can be excessive belching or flatulence. There's pain or discomfort in the abdomen, diarrhea, constipation, or both. And there can also be things like acid reflux. It's really very common in SIBO. Nausea, the sensation that food is sitting in the stomach and won't go down. Anxiety is very common. Brain fog is very common. Depression, less so, but can happen. Fatigue is very common. And weight loss. There could be normal weight. There could be overweight, but weight loss tends to be a bit more common because it is a malabsorption syndrome. We know that from studies that about 60 to 70% of IBS or irritable bowel syndrome is due to SIBO. And this has been really remarkable information to have this, because now we have a much better idea of what to do for IBS. In terms of the prognosis, studies show about a third of SIBO cases are not chronic and resolve completely. But very unfortunately, the majority, about 2/3, are chronic, which means there'll be relapses. Chronic means a relapsing condition, which is unfortunate. But the good news is it doesn't mean we can't get their symptoms almost all the way gone, if not all the way gone. We have a very, very high success rate with symptom remission when treating SIBO. And one other thing about that 1/3, 2/3 is that, I don't know if any of you seen this, but I see it all the time. The 1/3 are a lot easier to treat generally that are not chronic. The chronic patients are much more challenging to treat. And sometimes practitioners only see one of those types of patients. And it's almost as if it's two different conditions. And when we get together and talk, it's like, what are you talking about? That's not the SIBO I see. So it's really like two different patient populations. I really hope that you're not hearing that construction noise next door, because it's quite loud for me. So hopefully it's okay.
I don't hear it, so I think you're good.
Okay, good. I'm so glad. Okay, so the other thing Dr. Steven Sandberg Lewis and I did at the SIBO Center was we created this SIBO treatment algorithm. And it's a variation of Dr. Pimentel's original SIBO treatment algorithm that he first published in 2006, which is a very long time ago. And we published our version, I think, in 2012 or something like that. So when Dr. Pimentel created his version, he actually validated it for about 7 years with studies on the various steps, and also used it clinically with his patients to validate it. So it's an extremely well-validated algorithm. We made our variation, just a few little tweaks, like for instance, adding herbal antibiotics into the treatments. And we validated our version clinically for several years before we published ours. So I just want to take you through it briefly, because this gives an overall sense of how to treat SIBO methodically and what's been validated to work. So at the top, we suspect SIBO based on symptoms and history. We just went over the symptoms. And then typically what many of us will do is, before we actually know what's going on, just when there's GI symptoms, we'll try some first and second line therapies, like cleaning up the diet and trying various digestive supplements. And I wanted to just share some of my favorite from Microbiome Labs for this. The kind of things we think about doing are enzymes, prebiotics, probiotics, etc. If you suspect SIBO, I think FODMAPE is a wonderful enzyme to try. It's designed specifically for those food issues, and I love it. I recommend it all the time. That's a great one. For prebiotics, MegaPre is amazing. There are studies that show that it has kiwi in it, and there are excellent studies showing regulation of bowel movement patterns, particularly in constipation with kiwi. So MegaPre is awesome. For probiotics, ZenBiome Dual, the HU58, and of course, Megaspore Biotic. Megaspore Biotic is, the workhorse and seemingly everybody's favorite. And so I wanted to put a picture of ZenBiome Dual on the screen because I think it doesn't get enough love, and I wanted to give it a little love. This is actually my personal favorite for the SIBO patients that I have tended to see, which are actually very sensitive patients. So for people who see very sensitive patients, meaning they react readily to supplements and medicines, usually there's histamine intolerance involved, or MCAS. And I find, of course, not with everybody, that ZenBiome Dual is very well tolerated by histamine intolerant people. So I just wanted to shout out for ZenBiome Dual. And then, an overall multitasker for GI would be Mega IgG 2000. It just does so many things, like it's anti-inflammatory, it binds and decreases LPS or endotoxin, of which we're going to have an excess amount in SIBO. It helps the immune system, and it helps leaky gut. So I think that's a wonderful thing to use just as a multitasker for GI. Okay, so now let me finish going through the algorithm. If we try these supplements and they're just not cutting it for what a person is ailing from, that's when we need to move on to diagnosis. And that's when we would do the SIBO breath test. Once we have a diagnosis of SIBO, we have 3 main treatments antimicrobially that we can pick from: pharmaceutical antibiotics, herbal antibiotics, or elemental diet. And I also have, just following a SIBO diet on the right-hand side there, not really attached with lines, because we can sort of start it at any place. It could be started earlier, later, at any place in this algorithm, and that just depends on the case. When we're done with treating, that's when we give a prokinetic to hold the gains we've made. Siobhan was mentioning prokinetics. Then we assess what our treatment just did. On the left-hand side, if a patient is 90% better, I like to shoot for 90%. Many will shoot for 80%, 80 to 90%. If they're better, that's great. We move on to prevention, which includes a prokinetic, a SIBO diet, and some other things. Moving over to the right, if they are not fully better, so not 90% better, they're less than 90% better, this is the time to do a breath retest. And there's two main things that can happen here. One is, even though they still have symptoms, the test might now be negative, which means those remaining symptoms aren't from SIBO. It could be from the underlying cause of SIBO, or it could be from something else. Most people have more than one thing wrong with them. So in that case, if we get that negative test, we know to look for something else that's going on. And it's very helpful to know that we don't want to just keep treating SIBO if it's actually gone. Now, all the way on the bottom right, what often happens is the test is actually still positive. And what we do is follow the arrow around the right-hand side and come back up and treat again. So SIBO is a condition that usually needs more than one treatment round. Of course, we get the wonderful one and dones, but most people are what I call time and fine. They just need a few treatment rounds because this isn't, a typical like acute infection. This is more like a chronic infection. In fact, it doesn't even meet the definition fully of an infection. And so we just treat until we get effects. And for many people, one round just can't do everything that needs to be done. So we basically keep working it through with doing treatment rounds until we get that negative test or symptoms to 90% better. And then the final thing on the bottom left is, what if somebody was good, they were in remission, but then they relapsed? In that case, we do two things. We try to figure out what is causing it, because now we know there's something continuing to cause it, and we need to see if we can figure out what it is and treat that. And then, of course, we go back around and treat the relapse with antimicrobials. There are all sorts of things that are not included in this algorithm. This is just like your sort of streamlined, basic what to do. We're not talking about all kinds of adjunctive therapy. This is just the streamlined algorithm. So what I just want to say about this in general is following a methodical step-by-step approach like this when treating SIBO greatly increases overall treatment success. Not skipping steps and really just working it through in a timely manner, because without it, what usually happens is we add unnecessary treatment time, like add unnecessary time to the whole treatment process, and we just get less successful outcomes. We were able to get very consistent, successful outcomes with this algorithm. And also, it helps reduce all the decisions we have to make. And I think, we all can suffer from decision fatigue, especially with complicated patients, and it gives us confidence in what we're doing. So there are three main types of SIBO based on the three gases that the overgrown microbes make: hydrogen, methane, and hydrogen sulfide. And we have a fourth category when two or more gases are positive, and that's called mixed. And usually this is hydrogen and methane together, but it could include hydrogen sulfide. These gases are correlated with bowel movement patterns, like similar to the classification of IBS. So hydrogen is correlated with diarrhea. Methane, we know, causes constipation. Hydrogen sulfide, it could be diarrhea or constipation. And for mixed, when it's hydrogen and methane, it's usually both diarrhea and constipation in some sort of a mixed pattern. Now, something I want to mention is, in terms of these types, the methane type has been basically reclassified and given a new name, which is intestinal methanogen overgrowth, or IMO for short. And this is because it's not actually bacteria that are overgrown, it's archaea or methanogens. And so the B in SIBO doesn't fit. And then also these can overgrow in the large intestine as well. So they broadened the term to intestinal. And then hydrogen sulfide also recently got a new name just about 2 months ago at the big DDW conference. That's the biggest gastroenterology conference internationally. And this is called intestinal sulfide overproduction. Once again, using the word intestinal because the microbes can overgrow in the small or large intestine. So it's really only the hydrogen SIBO that is small intestine only. And we also have ICD-10 codes for SIBO now. This started coming up about a year ago. October 2023 is when this went live. And then they were put into the EPIC system for EMR in January. So the overarching category is intestinal microbial overgrowth. Then we have SIBO, hydrogen subtype, hydrogen sulfide subtype, or unspecified. We have SIFO, small intestinal fungal overgrowth, And then on the bottom is the intestinal methanogen overgrowth, which the old name for that was methane SIBO. And I still tend to call it that because I'm so used to it. So we can use these codes now, when we're ordering tests and things like that. It's fantastic. I'm so glad. So why the SIBO gas types matter is because treatment is based on the gas type when we're using herbal antibiotics or pharmaceutical antibiotics. So we vary what we're using, different herbs or different medicines, based on the gas. Fortunately, elemental diet works on all gas types. But this is why testing is so important. It's absolutely crucial for treating SIBO correctly because we need to be able to identify the gases. We also need to know how high the gas is because when we have very high gas, elemental diet is most likely our best option. I'll come back to this and explain why. The reason why we need different herbal antibiotics or pharmaceutical antibiotics based on the gas is because it's actually different microbes that are making the different gases. And here are the different bugs that Dr. Pimentel and team have found so far to be the overgrown culprits in each type of SIBO. Some of this information came out just 2 months ago at DDW, so very new. Some of this we've known about for years, and some has been being discovered over the last few years. So just briefly, hydrogen, it's E. coli, Klebsiella pneumonia, or aerogenes. For methane, it's M. smithii, and there are others. I'll show you in the next slide, to a lesser degree in the small and large intestine. And they know the exact strains now. I just simplified the slide. I didn't put it down. For hydrogen sulfide, it's Fusobacterium varium and Desulfovibrio piger. Those are overgrown in the large intestine. In the small intestine for hydrogen sulfide, it's Proteus mirabilis. And I won't say the other ones because I'll butcher them, but you can see them there. So that's very new information. If you're interested in these types of updates, you can sign up for my email list. I update everybody. I synthesize all the new information and send it out to everyone. And I have my newsletter sign up on the resources slide at the end of the slide deck. Or you can go to my website, SIBO Info. So this is a summary slide taken from one of the presentations from Dr. Pimentel's team at DDW from 2 months ago that shows you exactly all the bugs. It shows you the names, where the things are overgrown, correlates with symptoms, and the exact bug. So this is where we are now. It's been amazing progress to figure this all out. In my journey of since 2010 of looking at this is just thrilling. And the reason why it's thrilling is it will help us with our treatment. It'll help us help our patients when we know what we're treating, right? So it makes sense that we have to vary our treatment based on what microbe we're trying to reduce, because we know that different antibiotics are used for different conditions depending upon what bacteria or microbe is present. So an important point is that since the microbe that produces methane is archaea and not bacteria, it actually, we find clinically, takes extra and different antimicrobials to kill it. And typically we need double antibiotic therapy or herbal antibiotic therapy because of this. So I'll come back to that. So the three main antibacterial, antimicrobial treatments, as I've mentioned, are antibiotics, herbal antibiotics, elemental diet. And the natural ones are herbal antibiotics and elemental diet. And that's what I'm focusing on talking about today. When it comes to studies on these treatments, we have very good success rates that are published, anywhere from 70 to 91%. And actually, there was a new elemental diet study that just came out 2 months ago at DDW that actually showed 100% success for hydrogen SIBO. Just incredible. 70 to 91% are excellent stats, much better than for many other conditions. And the studies fortunately show that the natural options work just as well as the pharmaceutical antibiotics. And clinically, we see this as well. Equal effectiveness from all three treatment types is what I see. Sometimes something doesn't quite match for a person, but we have that with everything. So now just getting right into the herbal antibiotics. A little background thing that's important to know is that hydrogen is actually converted into methane and or hydrogen sulfide by those overgrown bacteria, the methanogens and the hydrogen sulfide producing microbes. It takes 4 hydrogens to make 1 methane and 5 hydrogens to make 1 hydrogen sulfide. So for patients with methane, hydrogen sulfide, or mixed gases, our treatments need to kill the hydrogen-producing bacteria, as well as the archaea that make methane or the bacteria that make hydrogen sulfide. So this is another reason why we use the double herbal antibiotic therapy for methane and sometimes hydrogen sulfide. We use one agent for the hydrogen and another for the methane and sometimes hydrogen sulfide, because the different herbs target the different bugs making each gas. This is actually a key treatment point that is often missed, and one of the most common reasons that I saw for treatment failure of patients who were referred to me. Patients that were methane positive, for example, this was very common, were not given double antibiotic or herbal antibiotic treatment, either because their practitioner didn't know there are different types of SIBO, or that different treatment is needed for the different types of SIBO, or what treatments to use for each type, which I'm going to share with you. Or maybe they didn't know what type of SIBO their patient had because they hadn't tested. So crucial for getting better outcomes. So there are two key herbal antibiotic strategies that are used: 2 or 3 single herbs at a time, or combination formulas. The 2 or 3 single herbs at a time approach has fewer herbs, and that is better for more sensitive patients, because then there's less to bother them. And if they get aggravated by something, it's much easier to identify which herb is bothering them if there's only 2 herbs, right? You just take one away. Also better for high gas scenarios, since we know multiple treatment rounds will be needed, and resistance can, and I found it was pretty common for resistance to develop. So I always like to have something in reserve that I can bring in and use for the future rounds. For the combination formulas, these target yeasts and parasites too. These are better for less sensitive patients and lower gas scenarios where not as many multiple rounds or no multiple rounds are going to be needed, so you don't need to reserve herbs for future use. So it's really just a matter of the type of practice that you have and the type of patient you tend to see. The first one is the type of patient I tended to see, so that's what I used: the sensitive, high gas, tough chronic case patient. But basically at the SIBO Center, we tried a lot of combination formulas and, liked a lot of them. But what we found over time was, because we were a specialty center, we needed better control of dosing and better targeting for the different types of SIBO. Combination formulas are less targeted, and they have some pitfalls which you can compensate for, and I will explain that in a minute. But basically, PCPs, primary care non-GI specialists, tend to use the combination formulas with really good results, because it helps kill whatever might be there. It's like, throwing a net and seeing what can get done, because patients often have yeast overgrowth and other things, and that's a very successful approach. So how long do we do this? What's a round? For herbal antibiotics, 1 month or 4 weeks is we consider to be one round. We often will go to 6 weeks. It's just like basically a round and a half for people who have higher gas. So what do I mean by higher gas? Maybe 55-ish parts per million hydrogen or methane or above. One month of herbs equals 2 weeks of pharmaceutical antibiotics. 6 weeks of herbs equals 3 weeks of pharmaceutical antibiotics. The herbs work just as well, they just take a little longer. Now, typically, we don't go past about 6 weeks because we see minimal added benefit past 6 weeks. Many of my patients would begin to relapse towards the end of 6 weeks-ish, sometimes even sooner. Basically, the effect has waned. It's not working anymore. It's not doing anything, and they're starting to relapse. Now, if it's still working, I've certainly seen many cases, this is just a pattern, right? Many cases where you can go longer. If it's still working past 6 weeks and symptoms aren't returning, by all means continue. You just need to be in communication with your patient, or they need to have been informed about this and know how to judge it, and be sensitive enough to tell. So let's go over the single herbs first. For hydrogen, we use berberine, oregano, or neem, and they all have equal efficacy. For methane, we use Allison, or a small combination product that I'm abbreviating as ATR, and I've got the herbs listed there for you that are in it: red corbacho bark, conker tree, and peppermint. I find this to be a little more hit or miss compared to the Allison. I'll explain that in a minute. And then in parentheses, I have oregano here because while I myself was not able to validate oregano as a reliable herb for bringing methane down day in, day out, I've recently found out about 5 of my colleagues have found it to be reliable for methane. So I'm putting it here based on their recommendation. I myself haven't seen that with all my before and after testing. Sometimes it does, but not really reliably. But I'm putting it there because 5 colleagues said it does. So there it is. And then for hydrogen sulfide, we use bismuth or high-dose oregano, and sometimes uva ursi. And then when we have mixed gas, we use combinations of these based on the mixtures of gases. So there are many other herbs that can be used and are used for SIBO. So, don't worry if I've left your favorite out or something. What I'm sharing with you are the foundational set of herbs that we validated to work for each type of SIBO, each gas type of SIBO. Like basically the absolute proven workhorses that day in, day out brought each specific gas down on testing. So just for example, pomegranate is a fabulous herb that many are loving using for specifically hydrogen SIBO, but I do not have extensive before and after tests on it like the herbs listed here. So use whatever you would like and whatever's your favorite. I'm just sharing what is proven successful over many, many years of testing. Okay, so for hydrogen, we basically use 2 of berberine, oregano, or neem. So we would be using berberine or neem, berberine or oregano or neem. One thing to note is the dose of berberine that we use, which is 5 grams a day. It's a lot. It's like heroic dosing. That's about 9-ish caps for many different brands, or more, depending upon the brand. So you want to check the potency per cap and calculate. Many practitioners have seen berberine work at about 3 grams a day, but for many patients, 5 grams a day is what is needed and works better. So I would say 3 grams a day would be the minimum needed. I have seen many patients who took 3 grams a day and treatment failed, and simply bringing the dose up to 5 grams a day then worked. So I would recommend using 5 grams as your sort of standard and only going lower if patients can't tolerate that amount, if they're sensitive to it. If you haven't found berberine to be effective for SIBO, this could be a reason why, if you weren't giving this amount, you may have been underdosing. So just some notes on these. Berberine is not an herb in and of itself. It's a constituent in many different herbs, and I've listed them for you here. And oregano can be kind of caustic to mucous membranes and aggravate them, causing GI pain. We found that a dry tablet form of oregano was better tolerated by many than like liquid oregano, like oregano oil, basically in the gel cap. Many people tolerate that just fine, but we did see a lot of very sensitive patients. So for people who get pain from oregano, you could try switching them to the dry tablet, and that might work better. And same with oregano, check the dosing on the previous slides, make sure. I find that generally with the oregano oil in the gel cap, you can do a higher dose than the dry form. The dry form seems to work at a lower dose, equivalent to a higher dose in the oil and cap. So for methane or methane and hydrogen together, we add Allison or ATR to one of the hydrogen herbs. So it would be berberine plus Allison or ATR, neem plus Allison or ATR, or oregano plus Allison or ATR. And sometimes we can use ATR just by itself. And once again, I have the herbs that are in ATR listed on the bottom. So this is double herbal antibiotic therapy. The berberine, neem, or oregano are for the hydrogen bugs. The Allison or the ATR are for the methane bugs. Some notes on these. Allison is an antibacterial constituent in garlic. We find that it's very well tolerated by SIBO patients, whereas garlic itself, the food, the herb, is highly fermentable and poorly tolerated by SIBO patients due to the FOS that it has, the fructooligosaccharides. So I would recommend avoiding whole garlic or garlic oil supplements because they could unnecessarily aggravate SIBO patients. If you've used them in patients without aggravation, wonderful. It's just, if someone gets aggravated, you may want to then switch over to a more concentrated form of Allison itself. And also watch out for Allison like named products like on the front label that are actually really whole garlic when you turn it around. That can be very confusing. Also, many patients know that garlic is a trigger food for SIBO, so you may need to explain to them that Allison is different to calm their fears, that they may be too afraid to take it otherwise. And also, like berberine, check the amount of actual allicin per cap, because the dosing I had listed on the previous slide is for the allicin itself. Use the proper dose. So for the ATR, this has a different mechanism of action. This is actually a small combination formula that's been studied for reducing methane and shown to be able to reduce methane. So we know it has activity against archaea. The mechanism is that it inhibits methane gas production instead of its primary mechanism being, antibacterial. That's really its secondary mechanism, and it's sort of weak. It has some antibacterial activity, but more so, it inhibits the methanogens from being able to create the methane gas out of hydrogen. So because of this means we continue this product at a lower dose if it's successful for someone to continue that effect, because we haven't actually fully reduced the overgrowth. We're really just inhibiting the formation of the methane gas. And that's really what causes all of the, most of the pathophysiological problems is the gas itself. So it's for this reason of the different mechanism of action that we have found Allison to be a little bit more hit or miss. I'm sorry, ATR to be a little bit more hit or miss and not as reliable as Allison, because it isn't directly, strongly bringing that overgrowth down of the methanogens. But when it hits, it's like a miracle. I've seen many, many patients where it stopped constipation and lifelong constipation in just a few days. If it's going to be a miracle, that usually happens quickly, like 2 or 3 days. I think that's part of the definition of a miracle, wouldn't it be? I don't know. But for this, it happens usually pretty quickly. Otherwise, it just works, in the month or 6 weeks, like normal. Now, hydrogen sulfide, we use bismuth, high-dose oregano, either alone, each one of them, or in combination with each other, and sometimes uva ursi and silver in combination. So we use bismuth or bismuthiol complex, and I'll explain that next, or high-dose oregano plus bismuth or bismuthiol, or high-dose oregano plus uva ursi, or bismuth or bismuthiol plus uva ursi, or uva ursi plus silver. So the high-dose oregano is an old blastocystis hominis treatment, and we do find a higher dose is needed for the hydrogen sulfide. When using a dry tablet version of oregano, this translates into 5 tablets 3 times a day for the first week. So that's a lot of pills. And then 3 tablets 3 times a day for the next 3 weeks, giving a month total of treatment. So about the bismuth, the mechanism of action is that it is antimicrobial, proven so in studies, but also binds hydrogen sulfide to then be excreted out of the body. Where we can get it is over the counter, bismuth subsalicylate, various brands carry this, various generics have it. There's a famous pink version that I just wanted to make note that all of the forms, including pills, actually have sugar alcohol in them. I do not know why it's in the swallowable pill form, because sugar alcohols are sweeteners. And just to note that sugar alcohols can aggravate SIBO symptoms. However, it's probably in such a small amount that it won't aggravate most of anyone. But if you have a super sensitive patient, it could be a reason why something like that might not work. There are other brands that don't have any sugar alcohols in them. We can also get this compounded. We can get bismuth compounded as bismuth subnitrate. Most compounders do this at around 700 milligrams a cap. Now, bismuthiol complex, what this is Dr. Paul Anderson. I don't know how many of you know him. He's wonderful. It's his bismuth antibiofilm formulas, and he has 2 versions of this. He originally came up with this as a compounded prescription, and I have the formulas for you here. I've also linked his PDF for you in the slide deck, so you can just see his PDF on this. And then he also has an over-the-counter version that I'm just abbreviating as BP2A, and this is bismuth subnitrate. Oh, I spelled that wrong, sorry. Alpha lipoic acid and black cumin together. And so basically what we found is that the thiol form of bismuth is effective at a lower dose compared to just regular bismuth, which is really great for bismuth toxicity concerns. Bismuth in too high of a dose for too long can have toxicity concerns, which are reversible when someone stopped taking it. But, why would we want to get into that? You know, where this happens more than not is patients like it, it makes them feel better, and they continue taking it even when we do not want them to and have told them to stop. That's where I've seen cases of toxicity. So and between these two, the over-the-counter and the compounded, the bismuth-thiol prescription, the compounded one definitely is stronger than the over-the-counter, but the over-the-counter is good too. They're both effective. Now, when we have mixed gases, if it's hydrogen and methane, we use the methane protocols. If it's got hydrogen sulfide in the mix, we add either bismuth, bismuth-thiol, or high-dose oregano. Just make sure one of those is in the protocol. So just showing you a case for herbal antibiotics. Here's the before and after. On the left is the before. So in this case, the hydrogen is as high as 75 in the first 2 hours. And then the methane, we use the whole 3 hours for interpretation. And we see it got as high as 11. So this is, hydrogen and methane. The treatment was neem plus Allison for 4 weeks. And also 4 days on, 3 days off of bismuth-thiol antibiofilm as an antibiofilm remedy, actually for the purpose of antibiofilm, not for the hydrogen sulfide aspect. Sometimes, we use antibiofilm in SIBO, and that's sort of all of those adjunctive things that weren't on the algorithm that, fill in the white spaces, that we can talk about certainly in my courses and in other places or in the Q&A if you want. So what's the result? After 4 weeks, hydrogen came down now to 19 in the first 2 hours, down from 75. So hydrogen decreased by 56 parts per million. Methane came down to 3 from 11. So that's decreased. And what happened? The symptoms were resolved, and it's a negative test. I didn't note what the symptoms were in this case, but I'm pretty sure it was bloating and constipation, maybe others. I didn't write it down. But basically, this was just a wonderful result, and it was a one and done. So I wanted to show you one of those beautiful cases that we all wish we could have for all of our patients. Now, about combination herbal antibiotic formulas, these have been studied for SIBO. We were so pleased in 2014, a study came out, and what it showed was they are equally effective as pharmaceutical antibiotics. The study didn't mention the different types of SIBO. Clinically, what we find is the formulas used in this study seem to be best for hydrogen SIBO. So what happens is, unfortunately, many try to treat their methane patients with these formulas from this study, and then they have inconsistent or poor results. So if you've tried the formulas in these studies and found them to be hit or miss, that could be the reason why, because they're not targeted for methane or hydrogen sulfide. And really, that's the issue with most combination herbal antimicrobial formulas. So in this study, they used 2 separate protocols, and I've listed the herbs for you here, protocol 1 and 2. And I just want to share some notes on these that are fairly transferable to any combination product that we use. But in combination 1, we just basically found to work better than combination 2. Because it's similar to what we had already found to be successful, oregano and berberine, basically. It certainly works for some, and the study found it to be effective, but we wound up seeing many referrals for people for whom it hadn't worked. And what we often found is if we would just switch them to a higher dose of berberine, and maybe sometimes even a higher dose of oregano, it would then work. So for many, the berberine dose is just too low. So this is an example of, check the dose, check the dosing on whatever products you're using and make sure it's coming into, into that 5-gram range or close to. The other thing is that formula number 1 or combo number 1 has quite a lot of thyme in it, and thyme can be like oregano, where it's too strong for some and it can be caustic to the mucous membranes. In the second combination, it's at a much lower dose and didn't seem to aggravate as much. But so, if you've got sensitive patients, these are the types of things you want to keep in mind. We found the bottom combination was better for what we call the unusual patient, meaning that all the standard herbs I just shared with you didn't work too well for them. So then we would try something different, and then often it would work. Basically, the key thing is you need to add allicin or ATR if somebody has methane to the combination formulas, whatever you're using, or bismuth or high-dose oregano if somebody has hydrogen sulfide. And just a reminder to know the gas types we do need to test, and that's why testing is so crucial for successful SIBO treatment. We're not, discussing testing today, but I just wanted you to know I do have resources for you on this that are linked on my resource slide at the end. I have a mini course on testing and a masterclass as well. I'd love to have you join me. So as I've mentioned, some of the notes, there are so many options for these combination formulas from all different brands. Many people have a favorite. They're very good for broad GI sort of infection treatment, not just bacteria, but yeast and parasites too. There is a concern to watch out for that it could cause double or triple die-off as we're killing bacteria plus yeast plus parasites. Some people don't tolerate die-off as well as others. Die-off is, for anyone who isn't too familiar, also called herxing, when all the little pieces of the bacteria, the cell walls get exposed to the immune system and they freak out and create inflammation and all kinds of symptoms. And then just keep in mind that combination formulas aren't made for the different types of SIBO. So for hydrogen, make sure there's enough berberine, oregano, or neem, at the right dose. For methane, the allicin or the ATR, or maybe the oregano at the right dose, and hydrogen sulfide, bismuth, oregano at the right dose. And remember to check the garlic form because the whole and the oil sometimes aggravate SIBO symptoms. So now that you know the exact herbs and doses proven to work, consider bolstering up your favorite combination formula with these additional herbs, because that's really how you get them to work better for the different types of SIBO. And just a tip for general SIBO success is if you've only ever used combination formulas for SIBO and you want better results, like you're not that happy with the results you've been getting, you may want to try the single herbs. Okay, so now let's talk about the elemental diet. And this one is briefer. There was a lot of background I needed to give you for the herbs. So this is a medical food beverage of pre-digested, easily absorbed nutrients. The proteins, amino acids, the fat or oils are not fully broken down, but they're oil. The carbohydrate is glucose or maltodextrin, and then there's vitamins, minerals, and salt. Basically everything, a person needs normally that they would get from their food. It comes typically in a powder form, and then it's mixed with water. And it's used as an alternative to antibiotics or herbal antibiotics and found to be as effective, 80 to 85% in the original study, now up to 100% in the new study that just came out, which is just amazing. So what it does in terms of its mechanism of action is it's basically starving the overgrown bacteria, but feeding the patient because the pre-digested nutrients absorb very quickly within the first 2 feet of the small intestine, so quickly that they're getting absorbed before they can be consumed. Those nutrients can be consumed by the bacteria. So the bacteria don't get any food and then they die by starvation, basically. And we've seen it to work for all gas types, which is just incredible, which is so wonderful. Now, a key point is that elemental diet can significantly decrease gas levels in 1 2-week round. So I've seen it do as much as 150 parts per million in 1 2-week round. So that can save a lot of treatment time having to go through multiple rounds of antibiotics or herbal antibiotics in higher gas scenarios. So it can be a quicker treatment. And this matters because, as mentioned, many with SIBO need multiple successive treatment rounds, especially when we're using antibiotics and herbal antibiotics. So the average reduction of gas in parts per million per treatment round for antibiotics and herbal antibiotics is about 30 parts per million on average, factoring in both the easy and tough cases, right? So just as a pattern, an average is we can expect about 30 parts per million per treatment round. Whereas elemental diet, it's about 70 parts per million. So you can see the difference there. And that's a major reason why we use elemental diet is because we can get, more gas reduced quicker. However, that was the pro, here's the con. It can be very challenging because what this protocol is the elemental diet is drunk in place of all meals for 2, or even if we extend it, 3 weeks. No solid food is eaten in the original protocol. and no other food or beverages, only elemental diet and water. So it's kind of like a form of fasting, even though the person is actually getting their nutrients. And, that's challenging. So many patients prefer to put that off and not do this treatment because they're just not sure that they can handle it. And they try it sort of as their last resort. Now, clinically, we find that many can eat a little bit with elemental diet and it still works, like poached chicken breast, skinless chicken breast, or an egg. And they can drink black tea or coffee and still get success. We do find that clinically. That wouldn't be the purest way of doing it, but we do see that. So the official protocol set forth in this study here on the slide from Dr. Pimentel is you do it for 14 days, and then you retest on the morning of day 15 once done. So the elemental diet is your prep diet the day before. And then in this protocol, you want to get the results as soon as possible. They used an in-house testing machine because if the patient is still positive, then you continue for one more week, doing 3 weeks total, and then you stop after that. If the test is negative, then you stop and begin preventative treatment. So because of this, some patients will, and some practitioners will just do this protocol for 3 weeks presumptively. Others are not willing to go a third week no matter what, because they didn't like doing it. And so you're just going to stop anyway. And if the retest is positive, you'll move on to a different type of treatment, antibiotics or herbal antibiotics. So with the protocol, we stop all non-essential medicines and supplements. Essentials, of course, essential medicines are continued. And we don't use antibiotics or herbal antibiotics concurrently because the bacteria are hibernating and they need to be replicating for successful antibiotic or herbal antibiotic treatment. So it's considered to be a bit of a waste of money. Although ATR is sometimes used in high methane cases along with elemental diet since it primarily inhibits methane production. There are some practitioners who have done that successfully. There are challenges, unfortunately, with this. So, as mentioned, no solid foods are eaten during the protocol, which can be very emotionally difficult. It all depends upon one's attitude. I've had patients who actually love it, and I have others who they don't like it. So depends on really how we frame it and how they're thinking of it and if it's a good match for them. There can be bad die-off, and there can also be blood sugar dysregulation and symptoms because it does have a lot of simple carbohydrate. So because of that, it's best if it's sipped over time and not just chugged down super quick, because otherwise it's, a big rush of carbs. So sipping over time is better for that. There can be taste issues. There are some unflavored formulas. Those are just awful. People really hate those. The flavored formulas, which can taste good, still though, it can be too sweet or just monotonous. And people get sick of it and they don't like that. They're all best iced or cold generally, that they do taste better that way. So icing or having them cold is better. There can be yeast overgrowth sort of issues, aggravation due to the simple sugars in it. That's a possibility. We could use antifungals during it if needed, if we're concerned about that. Weight loss is also possible if the full calories aren't drunk. So what winds up happening is patients don't want to drink it if they're finding the taste isn't, if it's getting annoying or something, and then they don't drink enough calories with it. And then that's where the weight loss comes. We do expect water weight loss of a few pounds that just comes back as soon as someone starts eating. That's fine. But we actually find for our underweight patients, this is actually a great method to help them gain weight, actually, so long as they're consuming the full calories, because it's easily absorbed. I've linked at the bottom, I have a video I recorded back in 2016 on my website. My website is just free educational resource. This is great for patients to show them the challenges they may encounter and the tips of what they can do to help if they run into these problems. So on the slide deck, I've linked that, and you can just find that on my website. Logistically, there are many brands commercially available, and I also have homemade elemental diet recipes that are less expensive. You can find that on my website, and I've also linked the PDF of the recipes here for you. So here's a before and after case example. We can see that the hydrogen is negative. It did not get to 20 in the first hour. The methane is as high as 134 at 140 minutes. We use the whole 3 hours for methane interpretation. So that's very high. I would call that severe, very high methane. And I do have the symptoms written down. The chief complaints were body aches, which is not a standard SIBO symptom. Diarrhea, that is unusual because this is a methane only patient and methane correlates with constipation, but it's just a pattern and there are always exceptions to patterns. It can happen. Don't be too freaked out if you see it, just move ahead with your treatment. Also, they had bloating, farting, burping, fatigue, and headaches, which is not a standard SIBO symptom. They did the homemade elemental diet for 2 weeks. And then the methane, you can see, wow, it's like all zeros down to 5 there in the 3rd hour. So it decreased by 129 from highest to highest level. All symptoms were gone in this patient, except fatigue. There was some remaining fatigue, but they said their digestion has been wonderful. So that shows you an example of the incredible effect elemental diet can have on SIBO. Now, just as I'm wrapping up, and then we'll go to questions, I want to address, what if you've tried the treatments that I've shared and find they don't work? First of all, don't judge by symptoms alone. You need to retest to see if the gas is lowering, because symptoms can take 2 or 3 treatment rounds to get better if gas is high. It's a lot of work to do, and so if you don't have a retest and someone isn't feeling any better, it doesn't mean the treatment wasn't incredibly effective, in fact. So for example, let's say you give berberine and Allison for 4 weeks and the patient doesn't feel any different. But if you had retested, you may have seen the methane lowering from 120 down to 70, which would be a 40 part per million drop. And that would be very good. But they still have a methane at 70. That's very high. So no wonder they don't really feel better yet. So that's the example there. Also, not all treatments click for everyone. Nothing works for everyone. Just try a different treatment if that happens. And third, sometimes only one of the 3 treatment types work. We see this very commonly, which is why I recommend varying treatments between pharmaceutical antibiotics, herbal antibiotics, and elemental diet. Just try not to limit your toolbox, especially if you're running into some challenges. And if you can't prescribe and the natural options aren't cutting it, you can always refer your patient to their prescribing doctor for antibiotics, and they can still follow up with you. I practiced telemedicine consults for years where I wasn't someone's official doctor. So that's what I had to do all the time. We're not discussing the pharmaceutical antibiotics today, but as mentioned, I have courses that go over that in great detail, a mini course and a full-length course. And it's a great idea to get familiar with those, even if you don't prescribe them, just so you know what's going on and you know what to tell your patient. Okay, and the last thing, if you find these treatments aren't working, is you might have a tough case, which is like the worst one. And that, in simplified form, would be when multiple appropriate treatments don't reduce gas or symptoms, or only offer minimal temporary help. And you've tried all 3 treatment types: pharmaceutical and herbal antibiotics and elemental diet. Usually this means something else is going on that's blocking our progress, like mold illness. That's one of the most common things we see that makes it so we can't progress forward in our SIBO treatment, or MCAS, histamine intolerance issues. And those need to be dealt with first before we can have lasting effect with SIBO treatment. So just before I summarize and take questions, I wanted to be sure you knew the resources I have for you. I have a free educational website. I've got a newsletter list you can sign up for where I do other free classes and I update everybody. And then I have multiple courses for people, including courses on testing, including a masterclass. And I have the coupon for you for anyone who wants to join me for the full-length course. So in summarizing, basically when treating SIBO, it really greatly increases success if you use a methodical approach, such as an algorithm like this, where you're going to test, treat, and then follow up in a timely manner and retest if they're not 90% better, and just go step by step, working it through without skipping steps for the best results. We have many herbal antibiotics that we know are proven to work by each gas type, and very fortunately, elemental diet that we know works for all gas types. Both of those treatments are natural and have excellent success rates. So as I close, just take a moment. I always like to suggest this. Take a moment to think if you have any patients you're currently seeing who might benefit from one of the treatments I mentioned or something that I mentioned, in the class and think about it and then write it down if you can think of who it is. And with that, Nicole, I'll turn it back to you for taking questions.
Thank you so much for that. I hope everyone enjoyed it. We do have the chat box, Allison, if you want to check in that. The question and answer box down here. There's a few questions in there if you want to pick some that you'd like.
Do you want to just read them to me? We could do it that way.
Let's see here.
Or if you don't, I can look.
I'm just wondering which ones would be best to answer. There's a few in the chat and everything else. Here's a good one. How can you be sure that SIBO test is negative if you can't lactulose? Is fructose the best option? And if so, what is the dosing for testing? What is the dosing for glucose too? As I've seen 75 grams and seen companies sending 25 grams or less.
Okay, yes. So yeah, if you can't access lactulose, just a couple of ideas is you could always ask your patient to go to their prescribing doctor and ask for a lactulose prescription, like maybe a primary care or something. Often we find that goes very well. Lactulose is, just used as a laxative in larger amounts. It's used for pets. Most doctors have no issue writing that prescription. So that's one option. And that to write that prescription, it's so you could tell your patient it's 10 grams per 15 milliliters. And we typically ask for it in 4 ounces. And then they take 10 grams. That's what we use for the test. And then I want to look up those numbers for you. I just want to be sure I have it right for fructose and glucose. Just 1 second, I'll get to it. It'll just take me a second. Because I don't have that. I just want to be sure I've got it right in my head before I tell you. Okay, so for fructose, it's 25 grams and glucose is 75 grams. Glucose is what comes in the kit, so that will come. Fructose would probably be my second preferred option. I don't have a lot of clinical experience with it. I'm just basing this on Dr. Jason Horlak's in-office study, which you may or may not know about, where he actually found fructose in his little study was the best at diagnosing SIBO, really astonishingly. So that anyone can access. You can order that in bulk, off Amazon, or it's sold in the bulk bin in my local health food grocery store. So that would also be a really good option. And any of these amounts, the 10 grams of lactulose, the 25 grams of fructose, or the 75 grams of glucose, those are put in 8 ounces of water mixed and then drunk. And that's how the substrate is taken.
Okay, and then one of the first ones is 4 years considered chronic?
It's really not how long someone has had SIBO. What the chronic refers to, I mean, yes, we could say that's chronic, but what I was meaning by chronic is once we've treated them and we've gotten their symptoms better or their test goes negative, so basically successful treatment, do they then relapse? That's really what the chronic refers to, and we could get into some nuances here because sometimes patients have done some treatment, but it wasn't really targeted successful treatment. Like what if they had methane, didn't know it, and they just took some berberine or something, that they really weren't treated for their methane. You know what I mean? So proper, appropriate treatment, proper remission. Do they then relapse? That's when it's considered chronic. And what's going on with chronic primarily is there's an underlying cause there that hasn't yet been identified, that needs to be treated, or maybe has been identified but is chronic in and of itself. There are many, many chronic conditions that cause SIBO. So, that's something someone will then have to deal with. But it's not a terrible bad sentence, because it's so doable to get people to 80 or 90% better. And then they just have to do a few management things, like take a prokinetic and maybe slightly alter their diet to keep that good symptomatic control.
Awesome. And then could you mention, please share again the book that you mentioned on antibiotics using herbals?
Oh yeah, it's just called Herbal Antibiotics by Stefan Bruno. I probably have it back there, but I won't take the time to pull it out. And then there was a second edition. Stephen Bruner's amazing, and I'm so sorry to say he's no longer with us. Both those books are great. And he also did, I think, Herbal Viral book, really amazing.
Okay, I saw one come in. What herbal prokinetic do you recommend?
So for prokinetics, herbally, we really have, well, now we have three sort of options. We have, I'm not sure if I'm kind of not mentioning any product names, so I probably won't, but there's a 9-herb combination that is available on Amazon that's now turned into a 6-herb combination. And I'll abbreviate it as IB. And there are dupes of it also on Amazon now, and it's a liquid, and it's been shown in studies to work well as a prokinetic head to head against pharmaceutical prokinetics, metoclopramide and cisapride. So I like that one. Then our second category is what I call the ginger containing prokinetic formulas. And we have a bunch of options for this. And actually Microbiome Labs has a version of this. And I'm so sorry, I can't remember the name of it, but it's ginger, artichoke, and it's got a little DGL licorice.
Oh, I believe that's our
Megagar. So that's a version of that. And there are many brands that make that. There's a patented formula of ginger and artichoke leaf that has been tested in studies and shown to work as a prokinetic successfully. And so many brands carry that patented formula. And then Microbiome Labs, just has those, not as the patented formula, but they just have that together. So, and basically the real crux is the ginger. Ginger is an excellent prokinetic specifically for the stomach, but also the small intestine, shown in studies to be effective. So it's a real workhorse for us. Sometimes we run into problems where people can't tolerate the ginger because it's a little too spicy. It's kind of a hot, spicy herb. There's two things to do there. One is, if that happens, a lot of people will just drink a cup of water and that takes care of it and they're fine. Then for others, like maybe for patients who have really bad GERD that's uncontrolled, it's not going to work for them. Then we just have to switch to something without ginger. And then our third one is another new product that came on the market that I don't have a lot of experience yet, but its primary herb that's doing the prokinetic effect is bitter orange. And bitter orange also has lots of studies in different forms for being an excellent prokinetic. So, and I don't have a favorite between all those three categories. I use them all, and I often use 2 or more prokinetics in patients because they need it. They need more. And pharmaceutically, we have multiple options. Our best option is prucalopride, which is sold in the US as Motegrity, very safe. We have some other options too, but that's a phenomenal prokinetic.
And I see this couple of question times. Is drinking hydrogen water a problem if someone has SIBO?
I don't know. I have wondered about that myself. I think I've heard a few people talk about it, and I don't know. I don't remember what they said, like knowledgeable people. I think I even asked Dr. Pimentel about that once. I'm sorry, I don't know. But you know what? When it comes down to dietary things like this, it's the old, most frustrating answer in the book, but it really is that each patient has to try these things for themselves and find out if it aggravates them or not. The last thing that a patient wants to hear, right? That we want to say. But it's true, because the individuality, when we look at the different foods that trigger symptoms in patients, is the most extreme you could possibly imagine in SIBO. It's insane. It's off the charts, the individuality. So if they're not too scared, they can try it and see if it bothers them.
Okay, we have a couple berberine questions. Is cheap berberine or oregano just as good as fancier ones? And does the hid dose of berberine impact blood sugar?
I haven't tried all sorts of different berberines and oregano, but my guess would be that it doesn't matter. If it's berberine, if it's oregano, so long as it's not been, I don't know, sitting around for 15 years or something, I would think it wouldn't matter. And then that's such a great question about the berberine, because now God, I saw an explosion of all these, videos and everything of people saying berberine is the new GLP-1 or GIP medicine, to take. I have personally never had a patient complain of that, of having their blood sugar reduced like too much where it was giving them symptoms. Although I have to say in retrospect, I've certainly seen a lot of die-off. Could it have been that some of the die-off symptoms somebody was having was, hypoglycemia or something like that? And I just didn't know it from berberine. That's possible. So it isn't something I suspected, but I think now that we know more, just keep an eye on it. And especially for somebody who has reactive hypoglycemia, that would be more my concern.
Okay, and this one just came in too for berberine. Do you have to do 4 days on and 4 days off with berberine?
No, we never do that ever. That the 4 days on, 4 days off is a strategy that, or 3 days on, 4 days off. I don't know if this is where your question is coming from, but that's a strategy for antibiofilm treatment from Dr. Paul Anderson. But for berberine, for SIBO, no, we just every day we take it for a month or 6 weeks.
And then another one about berberine, the probiotic advisor says high dose berberine depletes by phyto strain. Thoughts?
Oh, like bifidus?
Yes.
By the way, you're doing
that strain.
Thanks, Nicole. Oh, I love Jason Horrelack. Isn't he great? Okay, then. Gosh, I've asked Dr. Horrelack about this many times about all different herbs, and he seems to say something different about each herb, and I'm confused. But if that's what he says, I believe him. And then sounds like a good idea to supplement with bifidus. We didn't talk about probiotics other than in the beginning when I was giving some extra love to Zen Biome Dual. Zen Biome Dual has 2 strains of bifidus.
Yes. Okay, so we have some elemental diet questions. Other than doability, is there a drawback to the elemental diet? Where do you get it? And what does it do to stool quality?
There aren't really any drawbacks other than if somebody has a reaction to it, and that certainly happens. People can react to the different oils in it. Of course, I'm speaking from having seen a lot of sensitive patients. There are many people who have no issue with it all, but there's no like real concern. There's an occasional person, quite rare, who feels worn out from doing it. That is very rare. Most people feel good doing it. Where do you get it is, wherever you get supplements, basically, Amazon, Fullscript. I know Microbiome Labs doesn't have an elemental diet, but there are many, many companies that make their own versions of it. You just get it online, basically. And then the last one, I forgot what the last one was. Sorry.
What does it do to stool quality?
Oh, thank you. Thank you. It can do all kinds of things to the stool. Somebody can get completely constipated, so to speak. Do you expect someone to have stools when they're just drinking a liquid where it's just, powdered dissolved nutrients that are being absorbed into the body? No, not really. But some people get a constipated feeling. Do you know what I mean? And then other people get diarrhea. It's like, well, where is that coming from? And so they get diarrhea. And other people have no change at all. They have normal stool. Some people barely have any stool, but they don't feel constipated. All of that can happen. And it just depends on the patient.
Okay. What would you suggest for a person who is breastfeeding but has SIBO? Are there safe recommendations?
Yeah. Allison is thought to be very safe. And not berberine. Not the others. And Allison, by the way, Allison has effect against hydrogen, just not as strong. It's much weaker on the hydrogen front, stronger on the methane front. So if that's all you can do, then just do that. That's pretty much the main one. I think there's some pharmaceuticals you could take. I also have by the way, I have a free handout on my website, SIBOinfo.com, for pregnancy, lactation, and pediatrics. So you can also go there and you'll see everything discussed. And then for prokinetics, actually, LDN, it's a prescription, but we use LDN as a prokinetic, even though technically it isn't a prokinetic. It does have prokinetic effects in studies. And that is actually not only safe for pregnancy, but beneficial. It can actually help prevent miscarriage. So, and then the herbal ones should be fine as well.
So, do you normally do FIT 176 or MRT to your patients? I have some patients with SIBO positive for oregano.
Gosh, I'm not sure what those abbreviations stand for. My brain isn't putting it together. Do I do FIT or MRT? I'm not sure I know what that is. Can you pop it into the
So
question?
it looks like FIT is KBMO-IgG testing.
KB,
KBMO-IgG testing.
I don't even know what that is, but it's a form of IgG testing. Oh, are we
Yes.
talking about, oh, I'm sorry, you guys. It's clicking in now. We're talking about like food allergy IgG.
Yes. And the MRT is lymphocyte response food allergy test.
Yeah. Okay, sorry. Okay, this is a hard one. What I have tended to do is wait until after I get some good results with SIBO, and hopefully it doesn't take too long, to then run food allergy testing, because so many of the patients that I saw were very limited in their diet. They had self-limited, even stricter than I would want them to be. This is common because they, the one thing I didn't mention about the symptoms is all the symptoms come from food, or beverages. And it's just a natural reaction to become afraid of food. And so people restrict more and more and more so they can not feel pain and not have horrible symptoms. And so if I was to run a food allergy test, which I have done this, and then it says that they're allergic to one of the 5 foods they're eating, that is not okay. So I wait. I tended to wait until I got them doing a little bit better. They could expand their diet. Then we would run the food allergy test. If you do not have patients who you need to be concerned about them being super restricted, then I think it's fine to run it in the beginning. And between the two, I don't have an opinion. I've run them both, the different types, and I really don't have an opinion. But anyone who does, put it in the chat.
Do you have a resource for purchasing pomegranate peel and suggested dosing?
I think Heron Botanicals might, and I think because Microbiome Labs doesn't have any pomegranate, right? I don't want to be saying some other company.
Yeah,
I don't think
I'm like, I know one of our rep Catherine's in here. She said no too, so I'm glad she just backed me up on
okay,
that.
good. I think Heron Botanicals and maybe Naturopath Herbals. I think Naturopath Herbals. I think they're out of Canada. Am I right? No. Herbie's Herbs is out of Canada. They may also. I think it's Naturopath Herbals though.
Let's see. I'm trying to find some. Why treat with antimicrobial? Oh my God, I cannot speak today. Sorry. Before addressing the lifestyle factors caused in the first place.
So that was in the algorithm as first and second line therapies. That's what I would consider first line therapies. I can bring that algorithm back up for you. 1 second here, so we can all look at it together. Oh, here we go. Share the screen. So it's right here. Ignore this circle and just look here. First and second line therapies. So this is diet, lifestyle, supplements. I would consider first line therapy. This is just my wording. I would consider first line therapy, diet, and lifestyle. So this is like, Dr. Fresh Air, which I always love saying, sleep hygiene, chewing, all of our lifestyle things. Of course, reducing stress, of course, right? One of the hardest things to do, but one of the most effective. And then second line is what I would personally consider the supplements that I mentioned, the digestive sort of supplements. And also I would personally consider that to be modalities that we can use where we don't need a Western diagnosis, like acupuncture and all kinds of body work, et cetera, et cetera. So yes, please do that.
Okay, we're getting pretty close to the end. We want to be very mindful of your time, especially you East Coasters. I don't want to get too late for you. So this will be a two-part question that I'm seeing that can just kind of go together on breath testing. On breath test, what threshold numbers indicate SIBO for methane and hydrogen? And then if you're
Okay.
taking multiple strain probiotic, does it affect the stool or breath test?
Okay, so these numbers I'm giving you are, for lactulose, hydrogen of 20 in the first 2 hours, and I don't need to see a rise of 20, just 20 absolute, so long as the baseline is under about 10. There are exceptions to this. If there's a high baseline, I'm giving you nuances. If there's a high baseline, but you still see a rise of 20 and you see a double peak, that's confirmatory of SIBO. So, once you really learn all the ins and outs of interpretation, there are some nuances, but basically 20 for hydrogen in the first 2 hours. Methane, it's a two-parter. It's 10 or above in the whole 3 hours, including baseline. So the most common pattern for methane is what we call a methane plateau. It starts high at baseline and stays high, just little bits of ups and downs. That is common, the most common thing we see. But then the second part is between 3 and 9 parts per million is considered positive if the patient has constipation. This is Dr. Pimentel's interpretation criteria that he shared with us at our first SIBO symposium in 2014. And we all started using it back then, and it does bear out clinically. So that's what we use. So 3 to 9 if the patient has constipation, 10 or above, no matter the bowel pattern. And in all cases for methane, we're using the whole 3 hours, including baseline. And then there was something else. Oh, I think the question was, do probiotics affect the test? Like, can you be on probiotics and take the test, if I'm understanding that correctly?
Yes, if you're taking a multiple strain probiotic, does it affect the stool or breath test?
I think it could affect the stool test. I've seen that. I'm not worried about it with the breath test. So you don't need to stop that for the breath test at all.
Okay, and I'll do one final question. Do you use dihydroberberine or berberine HCl?
Berberine HCl, sometimes berberine sulfate, or just like regular old berberine that doesn't even say anything, just says berberine. I have heard that the dihydroberberine is the better one for sort of mimicking the GLP-1, GIP sort of things. I don't know if that's true. I've seen that. I've seen people saying it, and I don't see diabetes patients to test that in. So I have not used that form for SIBO. I have not.
Awesome. Well, I know there's questions we didn't get to, and I apologize for that. If we answered everyone's questions, I'm sure we'd be here for another 2 hours because I want to know these questions too.
I'm so glad you have questions.
Yes.
Fantastic. I'm so pleased to see such keen interest and excellent questions. Thank you. I appreciate them.
And Dr. Siebecker, you put your information on the slides, which is correct. So if you guys do have any more questions, I'm sure she'd be more than happy to answer them. She also has programs you can follow as well. So that is in the slides. If you didn't receive it, we're sending an email out, and they'll have access to the slides and the recordings. And you can always reach out to people on our clinical team as well, or even your rep. So please don't hesitate to ask anyone.
Thank
Okay.
you so much for having me. And thank you so much, everyone, for your attention and for being here. Wonderful to spend time with you.
Yes. And I'm going to do one more message to someone real fast. Okay. Just want to make sure they got the slides. And again, we will be sending out a follow-up with the slides, the video, and your exclusive discount for this round. And thank you so much, Dr. Siebecker. We really
Take care,
appreciate
everybody.
it. See you all
Bye-bye.
next time.